Imagine if you got deeper sleep, had fewer headaches, had a digestive system that wasn't always mad at you, and maybe you were even able to go out throughout your day feeling a little bit calmer and happier. What if I told you you can do all that without drugs, surgery, and taking an ice bath every day? And what if I told you a lot of that can be helped and achieved to working on these two small bones in your upper neck we call your C1 and your C2? My name's Dr. Tyler Antignolo. I'm the chiropractor here at Antignolo Chiropractic in McKinney, Texas. Today I'm going to talk about what we call your C1 or your C2, your upper cervical spine, as we call it. Talk about the vagus nerve. I'm sure you've heard about that and how it impacts your nervous system and the impact your vagus nerve and the relationship your vagus nerve has with your upper neck. And I also got some tips and tricks on how to see if your C1 and C2 need to get worked on, if you need to get an adjustment. Then I also got some adjustment videos for you at the end. So stay tuned, watch this video, send it to your friends. It may help you, your family, your friends. Yeah, stay tuned, have fun. So, talking about your C1 and your C2. If you're like, I don't even know what you mean, what are you talking about? What does C stand for? What one, two, yada yada. So your C in the spine talks about the cervical spine. So we have three sections of our spine: the cervical, which is your neck; thoracic, which is your mid back; and then your L or your lumbar, which is pretty much your low back down there. So C1 and C2 are the very first two vertebrae in your neck. C1's also called your atlas because it literally holds up your skull and your head, where your brain is, very important. And then C2, we call your axis because you have a lot of rotation in there. It's where a lot of the movement in your neck comes from. And it's super, super important. Your brainstem runs through right through here. There's a lot of nerves that come through. Your cranial nerves come exit that area. And then you have the nerve, which you may have heard of, called the vagus nerve. Um, so why am I talking about that today? So super easy test for you to do real quick to see if you have some restriction or misalignments in your upper neck. All you have to do, you're going to turn your head as far as you can to your left, turn your head as far as you can to your right. If there's any stiffness there, if you're like, hey, I can turn my head to the left pretty easy, I can see over my shoulder, but I can't turn my head to the right at all, you could actually have a misalignment or a shift in your upper neck in that C1 or C2 area, and you could need an adjustment. Also, super important, we talked about the brainstem being up there. If we see a lot of stress in these upper two vertebrae, the C1, C2, we can have people with a lot of symptoms with like headaches, anxiety, depression, vertigo. We see some ear issues because of the nerves that come through there as well. And actually, a lot of TMJ or joint dysfunction can also be related to dysfunction in your upper neck or your C1 and C2. I mean, this area in the spine, I check with almost every single patient, unless there's a reason I medically cannot check it. I mean, it's super important. Your brain stems through there. It's the very top of your spine. If there's a shift up here or stress, it's going to mess with the communication all the way down your spine to the rest of your body and the rest of your nervous system. So that's your C1, C2, the atlas, the axis, the upper cervical spine. Super important. We also talked about now the vagus nerve. So the vagus nerve, which is cranial nerve 10, also the wandering nerve, it's super important for our rest and our digest or our parasympathetic nervous system, which is also part of our autonomic nervous system. It's important because it regulates your breathing, your heart rate, your digestive system, your sleep, your mood. It's what helps your body calm down. It's what really what I mean. It's what controls your rest and your rest and digest. Um, Super important. So it's very, very integrated and super close and related to your C1, C2. So same thing, if we see a shift up here, we see dysfunction, we see stress, or we see a subluxation of C1 and C2, that can actually impact the function of your digestive system, how you're sleeping, and your mood, just because it's going to impact and have create dysfunction of that vagus nerve and impact that parasympathetic nervous system, which is not going to let your body calm down, find balance, and find rest. So sometimes if you're feeling off, you have all this anxiety, you have all the stress, you've had digestive issues for years, and sometimes these probiotics aren't working, the cold plunges aren't really helping, the deep breathing, the meditation. Sometimes it's not anything you're really doing, it's because you have stress and dysfunction in your upper neck. It's time to get checked out. I hope this video helps a little bit. I hope you got a little bit of education, learned something today, learned about how important the upper neck is, how important that vagus nerve is to the function of your body as a whole. Um, Again, it's not just about pain, not just about headaches, not just about posture. Chiropractic care and the adjustment, it's all about improving the function of the joints in your spine and then your nervous system as well. Because your nervous system is the most important organ system we have. If your brain's not working, your spinal cord's not working, nothing else is going to work. I mean, you've seen someone that's paralyzed from maybe the waist down in a wheelchair. They still have their bones, they still have the legs, they still have the muscles, the skin. They just don't have the nervous systems working properly to control and orient and facilitate all the function in their legs. I mean, that's how important your nervous system really is. So hopefully that helps a little bit. Again, turn your head side to side. It's a little stiff, a little achy, maybe not so easy to turn. Go see a chiropractor, get your neck adjusted. If you've been having sleep issues, digestive issues, anxiety, depression, TMJ issues, ear infections, things that are just not getting better, you're like, hey, I've tried everything. I've had antibiotics, the medications, this, that, and the other, and nothing's really worked. Go see a chiropractor, see if they'll help. We have crazy cases like that all the time here where, yes, I'm not treating your sleep issues. I'm not treating your gut issues. I'm just treating the dysfunction in your neck and your spine, helping your nervous system function better so you as a whole can function better. So hopefully you find it helpful. Here are some adjustment videos. Send this to your friends, your family. Maybe it'll help them. If you have any questions, leave them in the comments below. I would love to help. Always reach out. My name is Dr. Tyler Antignolo. I'm the chiropractor here at Antignolo Chiropractic. Have a blessed day.